I'm Kim Baker, CEO of the Central Local Health Integration Network. We're in the midst of an important day today to focus on strengthening the healthcare system for patients and their families. It's called Patients First, creating quality in the transitions of care. The challenges and opportunities in creating quality right across our local healthcare system is an important learning opportunity for us as system managers and planners, just as it is for our health service and primary care providers.
The passage of the Excellent Care for All Act in June has really elevated the conversation about quality in healthcare and the sustainability of our healthcare system. And for every one of us, whatever discipline, whatever role, be it staff or governance, whatever sector, we have an opportunity to contribute to the dialogue today to help us further the quality services and build on the capacity that's already being delivered in Central LHIN.
Moving from a focus on quality and safety within organizations to one that crosses organizations. So it's system-wide safety. It's understanding how to have safe, effective, high-quality care in an environment where you have to move between practitioners, between the hospital and the community, back to the hospital. And what can we do to make sure that that works more effectively?
I want to applaud the Central LHIN for really embracing this notion of how do we improve quality at the transition points in our healthcare system. It's really groundbreaking work you're doing. You're showing enormous leadership, and I want to say thank you for that. I want to tell you that this is a shining example of LHINs doing what only LHINs can do. I don't think anybody before we had LHINs was really thinking about how the system works from the perspective of the patient.
Every corner of our LHIN has unique healthcare needs, which are best met through local decision-making. By consulting with our health service providers and community leaders, we can identify and invest in local solutions to improve our healthcare system. By managing and funding healthcare locally, we can respond to better meet the needs of the people in our communities. By working with other LHINs, we can share information and best practices. You can see how we're working to advance high-quality care in Central LHIN to get better value for taxpayer dollars. Patients First is not just the name of a conference, it's how we're trying to work to strengthen services locally in Central LHIN.
I believe that the greatest gift that was passed to my generation from the generation before us was the gift of universal health care. That notion of universal health care is something that is way more than just a government initiative. It's part of our DNA as Canadians. So how do we protect that gift of universal health care? We got to make some changes now. Some of those changes involve commitment to quality.
We're proud of the progress we've made so far, but there's so much more to do, as we've heard today at our Quality Conference. You'll continue to see us engaging our communities and service providers and working hard to strengthen our local healthcare system together.